Weight-bearing foam impression. This is the least ideal form of casting with foam for patients with stability issues. Consider the seated semi-weight-bearing method if the patient has any stability or severe neuropathic complications. Start by placing the account number and the patient name on the inside of the box. Draw a line in the foam, approximately 1/2 to 1 inch from the cardboard to ensure adequate room for the patient's foot. With the patient standing and a stationary chair or counter nearby, place the box directly in front of the patient's foot. Request that the patient use the stationary chair or counter for support as you assist them into the weight-bearing position. Ask the patient to raise their foot and slide the box underneath their foot. With your assistance, guide them into the position in the foam. If you are able and willing, you can allow the patient to grab onto your shoulder for additional support through the process. Have the patient slowly step into the foam box. To ensure a complete weight-bearing impression, have the patient place their other foot beside the box. You may still have to assist with applying a small amount of pressure to the forefoot to capture the toes. With your assistance, have the patient lift their foot, heel first, out of the box. Check for good representation of the heel, arch, and forefoot.